Hi, everyone. Welcome to Leadership at the Forefront of COVID. I'm Dr. Pendo, Senior Medical Director for Experience of Caring at Intermountain Healthcare. And today I am pleased to have a conversation with Dr. Tony Wallin, the Senior Medical Director of Urgent Care and the physician lead for our COVID curbside testing. Thanks for being here today, Tony. We're happy you're here.
Thank you. It's a pleasure.
So let's start by talking about your job before COVID and then really how it changed once COVID came to Salt Lake.
Yeah, great. Well, before COVID, I was doing my medical director duties for the urgent care service line. And, lots of things to do, getting ready for, flu season, managing through the flu season. It's all about, staffing, et cetera. And then COVID hit right at that point where we are at our busiest, right, during influenza and other viruses. That was an interesting timing, right, because we felt busy enough already, and then things had to shift. The good news is because of COVID, the amount of virus, including influenza, dropped. So it sort of saved us a little bit so that we could focus on the task at hand, which was how do we test for COVID acutely. Honestly, that was an interesting moment because we were called upon, our service line, to provide the curbside testing for COVID on a Friday at 2 p.m. And we were asked to have that up and running by Monday.
Wow.
Yeah. And the first question was, how much testing do we need to do? And the answer was a lot. The whole state had to be covered. And so we ended up with over 20 curbside sites by Monday up and running. That was a learning experience.
And I'm guessing that it pulled from all of your leadership strengths and probably put you in situations where you didn't know things to be able to set up a testing site.
Well, I'll tell you what it did. It stretched my leadership, tools. And really what it taught me was in 3 days, you aren't going to do any of this yourself, right? And so relying on not one team, but many teams working together to bring this up to speed that quickly was the key. What I also realized was variability is actually okay in these situations, and diversity. I tell you, that's one of the biggest learning moments I've had in the last 6-7 months is diversity of thought, diversity of culture, of where people come from was actually a big strength on our team, because when you do over 20 sites with over 20 clinic managers at each of those sites, you're going to get a lot of diversity. Very helpful. And because we meet still every day, we discuss that diversity. It comes out as something that's okay, actually. And we actually learn a lot from each other, and we don't judge as much. I think before COVID, we would judge more. Why would they do such a thing? Now it's, what are they doing? I want to know more about it. Because we realized especially over that first few weeks, that was a very big strength of our team, or our teams, was having that diversity.
So I can't even imagine setting up those testing sites in 2 days. And you've been at the forefront of the testing and urgent care. How do you take care of yourself? What do you do?
Yeah, had to learn a little bit about that too, right? Because I would tell you in the first month, not well. This is so important and so acute. You put everything else on the back burner. And then you realize this is a marathon. This isn't a sprint. So what I had to finally realize is it's okay to stop, sit down, spend some time. Every night we do at dinner. We've actually spent most dinners out on our front deck outside. We've made it a ritual to eat outside on our front deck instead of inside. We've eaten inside forever. And all of a sudden we're eating outside every night with the kids. I make sure that I get my exercise, even if it means putting on lights on my mountain bike and riding in the middle of the night. It's okay. Got to get the exercise because the brain just works much better if I'm exercising. And you know what? I think my eating habits have gotten better because I'm not out and about and just trying to grab a sandwich or whatnot. I'm home more often, and so I'm able to make a salad or have a salad ready, that sort of thing. So the big things.
So do you think that that your self-care was something that just evolved, or were you really intentional in saying, I need to take care of myself, and for me, this is what I need, I know what I need, and I'm going to implement these things?
Yeah, it was intentional. And it's also, you have family members that help you with that, right? So in other words, you need to stop and start thinking about all of these other things because you get so engaged. It's over engagement almost in what you're doing that you don't you don't think of these other things.
Yeah. I think that's a good lesson for us, right?
Yeah. I think it has to be intentional.
Yeah.
Yeah.
So on the to-do list,
Yep.
Self-care. As you think about what you're faced with next, what are the things that keep you up at night?
I think the main thing is acutely is how are we going to manage winter, right? And that's what keeps me up is how do we manage winter? How do we manage this in a situation where we don't know what's next? We try to model, we try to look at other places like the Southern Hemisphere, and we say to ourselves, okay, this is the direction we ought to go. What does cause some anxiety is then determining what do we do if we're wrong. Our guess is this is our target. We're going to target this model. But what if we're wrong and we get much busier than we thought or not busy at all? Both problems could be a big problem for us. And so, with staffing and stewardship and all of those things. So that's probably what keeps me up at night.
Wow. So as you think about, as we end our conversation, this has been obviously, you said at the beginning, a period of time that's really stretched you as a person and as a leader. What are the things that you've learned that you can share with our audience?
Yeah, one, like I said in the beginning, is understanding where people are coming from. And that diversity of thought and experience is actually probably more important than probably everything that we do at work, at home, etc., is actually a big asset if you look at it that way. The other thing that I noticed all along was you almost have to be intentionally conscious about that at all times because it's easy to get into that. Why would they do such a thing? But it actually helps so much to try to understand each person's, where they're coming from, their experience, their thoughts, why they're doing things the way they're doing it. That's probably the biggest learning experience for me. And then the other is it's always a marathon. Most of the things we do aren't sprints. They're mostly marathons. And so treat it as such and do the other things you need to do with your family and take care of yourself, all of those things. They all make it so you perform better in a marathon.
I love that. I'm going to take away your intentionality and your welcoming of diversity as I step into the remainder of my week and next week. Thank you so much for being with us today. We'll look forward to talking with you soon. Thanks everyone for joining us. We'll see you next week. Bye-bye.